Hello, in today's video we will be walking through the Access NYC COVID-19 screening tool. Before we get started, we would like to disclaim that we are not professionals, and the information we have provided is done to the best of our knowledge with help from the website of the City of New York. New York City screening tool disclaimers. The screening is not a medical diagnosis of COVID-19. Employees and visitors are not being advised whether to consult a healthcare provider or to seek COVID-19 testing. Results are solely to determine whether the employee or visitor can report to the worksite. This screening tool is intended for use during the COVID-19 public health emergency only. Some screening practices may not be appropriate or lawful outside the scope of this emergency. Screening requirements may change. Check nyc.gov/health/coronavirus regularly for updates. Now, what is the COVID-19 screening tool? The COVID-19 symptoms screening tool is a sample screening tool for most workplaces. Some workplaces, such as healthcare or long-term care facilities, may have different screening requirements. Who is this screening tool for? It's for businesses that are required to provide documentation of health screenings of their employees as per New York City guidelines. Using the screening tool. New York State requires employers to screen employees for COVID-19 symptoms and exposure before the employee can enter the workplace each day. Employees who pass the screening still need to follow rules about physical distancing, face coverings, and hand hygiene. Employees who do not pass the screening cannot report to work. For more information on COVID-19, please visit this website provided. Direct your employee to call 311 for help finding a medical provider or accessing testing. You can also direct your employee to call 911 if experiencing a medical emergency. Safety protocols for screening in the workplace. When screening for COVID-19 in the workplace, be sure to follow these safety protocols. Maintain at least 6 feet of distance from others while waiting. Screeners and screened individuals must wear a face covering if they can medically tolerate one. Screen in a location that is not a confined space. For example, do not use a small office with a closed door. Design a way to screen that prevents others from hearing what is being said and to minimize others from observing screenings. Incorporate physical distancing, such as maintaining at least 6 feet between screeners and others, or physical barriers, such as a plexiglass barrier to minimize exposure during the screening. Now here's a sample employee or visitor health screening survey that you can use as a model for your business or workplace. We will now walk through it together. This is the top half of the screening tool. Starting with the first question, have you experienced a fever of 100.4 degrees Fahrenheit or greater, a new cough, new loss of taste or smell, or shortness of breath within the past 10 days? If the answer is no, you can go to the next question. If the person answers yes, no further screening is needed, and this employee may not report to the workplace because these symptoms indicate the possibility of COVID-19. Question 2. In the past 10 days, have you tested positive for COVID-19 using a test that tested saliva or used a nose or throat swab, not a blood test? If the answer is no, you may proceed to the next question. If yes, again, no further testing is needed. Question 3. To the best of your knowledge, in the past 14 days, have you been in close contact within 6 feet for at least 10 minutes with anyone while they had COVID-19? If no, proceed to the next question. If yes, no further screening is needed and this individual may not report to the workplace. Question 4. In the past 14 days, have you traveled internationally or returned from a state identified by New York State as having widespread community transmission of COVID-19? other than just passing through the restricted area for less than 24 hours. You can visit this website provided here to find out what states are identified by New York State as having widespread community transmission of COVID-19. And as always, if the answer is no, this person may report to the workplace. If yes, no further screening is needed because this person may not report to the workplace. And as a note, there may be additional New York State guidelines that apply to essential workers in your sector not included in this tool. Now, ideas for using the screening tool in the workplace. So these are some suggestions as to how you can implement the screening tool and screen your employees. The first way you could do this is by calling employees each workday before they leave home to ask the screening questions. You can also set up an automated phone line that allows employees to indicate yes or no and have someone monitor the line to ensure compliance. You could issue an auto-generated email or survey that enables a response. Or you can designate a screening area and distribute the screening questions on paper to employees when they arrive for work. If written forms are used, they should not identify the employee by name. Finally, safety protocols for temperature checks. So workplaces are not required to check employee temperatures, but if temperature checks are performed, be sure to use a non-contact thermometer, for example, an infrared forehead thermometer. Do not use oral, which is inserted in the mouth, or tympanic, inserted in the ear, thermometers. Strictly follow the manufacturer's instructions when using the non-contact thermometer. More help with non-contact infrared thermometers can be found at fda.gov. When non-contact thermometers are used and the screener does not have physical contact with an employee, gloves do not need to be changed before the next check. But screening areas should have alcohol wipes to clean equipment that accidentally touches the screened individual. And be sure to clean after each person is screened if there is contact. Now for some final notes on the screening tool, New York State requires documentation that health screenings have occurred. Employers are also required to maintain employee confidentiality. All information collected from employees must be kept confidential and can only be maintained in the employee's medical or health file in the same manner as the employer maintains medical notes for leave purposes. These records should be kept separate from the employee's personnel file. For more resources and videos, please go to our Contra COVID website provided here. And should you have any questions or concerns, please don't hesitate to email us at info@contracovid.com or call us at 617-942-0271. We hope this video was helpful for you, and thank you for watching.